If you have a viral illness, like you had mononucleosis, let's say, you can use all the antibiotics in the world. It's not going to affect the mononucleosis. It's a viral illness. It's Epstein-Barr virus. The hard part about all this is usually when you have a sinus infection, it doesn't start with bacteria just jumping in your sinus. It starts with a cold. It starts with a viral illness. And then you get swelling and mucosal thickening and stasis of the secretions, and the little sinus cavity in there closes off. And then you start getting the yellow discharge and the pain in your teeth and purulent drainage. And that's when you know you've got a sinus infection, and that's when you need an antibiotic. It's hard sometimes to look at somebody and go, okay, I know you feel terrible, but this is a cold, this is a viral illness, take some Motrin and Tylenol, and oh, by the way, in a week, you're either going to get over this or you're not, and then we're going to start antibiotics then.
Welcome to the Swain Sinus Show, a physician and patient discussion on how to better manage and treat mild to serious sinus issues and conditions. From diagnosis, treatment, home remedies, and surgery, Stacy and Dr. Swain will talk about improving your quality of life, breathing easier, and feeling better. Let's take control over our sinuses and allergies so they don't control us.
Hello, Dr. Swain.
Hey, Stacy, how are you?
I'm well. How are you today?
I'm good. Yeah, this is our 20th show. This is a big deal.
We need to do a cheers on our bottles of water. As we're recording now, we're about to go into Mardi Gras season here in coastal Alabama and Mobile. It also is cold and flu season. So a lot of my friends and a lot of your friends will probably be on antibiotics in the coming few weeks. I've heard that you're not supposed to drink alcohol when you're on antibiotics. Is that true?
Well, it depends. For the most part, I think that if you're having an occasional glass of wine and you're on some antibiotics and you're not taking the antibiotics and the
with your glass of wine?
Right, at the same time, you're probably okay. I think everything in moderation. There are some medicines that you can't take with alcohol because they have severe side effects. Like everything else, it depends on what the antibiotic is, what the chemical is that you're taking, and obviously how much partying one is going to do. Certainly a lot of the complaints people have with garden variety antibiotics is GI upset, is stomach upset. And if you're having a lot of alcohol, that certainly can aggravate that as well. You know, you mentioned about the cold and flu season. Well, one of the other things right now that's happening is my car this morning is all yellow with all this pollen that's starting to be out in the air. And so, you know, when somebody comes in and they're sick, sometimes is it allergies we're trying to figure out? Do they have a cold, or do they have an actual bacterial infection? And sometimes it's really hard to tell. That's why we have to get x-rays sometimes, or we check blood work, or we look in the nose to try to figure out, you know, what's going on. And the history obviously is so important. Some people will come in and say, look, you know, I get sick twice a year. I get sick twice a year. Put me on some antibiotics and I'll be fine. That sounds reasonable. The other people come in and say, you know, I'm sick, but I've also got this terrible allergy problem. And sometimes it's a little harder to try to figure out, you know, when you have a bunch of allergies and the nose is kind of chronically inflamed, and then you have this insult on top of it, this infection on top of it, whether it's viral or bacterial, the nose doesn't look right, or the oral cavity doesn't look right, and it's hard sometimes to figure out what exactly to do. The most common thing we think of, the most common situation that this presents itself usually is with nasal congestion. People will feel pressure in their face, and you're trying to figure out, is that allergy or is that a sinus infection? Okay.
I've always wanted to ask a doctor, really, do I need to take antibiotics all 10 days?
Depends on the type of antibiotic, but if it's a bacteriostatic antibiotic, if you're looking at the pharmacology and the microbiology of it, you want to have that antibiotic for a certain period of time to make sure that you have eliminated all of the bacteria. The hard part is when you eliminate enough of it, people start feeling better.
Right.
And so they don't want to finish the whole course of it. So what you've done then is you've given that bacteria enough of an insult, or the chemical, just enough that they can say, okay, and you didn't kill them all. Then they have enough and they start making the genetic changes to endure that the next time you get that medicine, that antibiotic. Okay. So that's how we induce antibiotic resistance, is number one, not being good stewards of our antibiotic when somebody comes in and they're of the viral process, because you're trying to help them. Obviously, it's not intentional, or they have the intention of not wanting to be sick, which is very reasonable.
Right.
Or you don't take all of the medication when it's been prescribed, and the bacteria get enough of the insult to be able to recover from it, and they come back stronger.
Okay. Let's transition from a little bit away from the antibiotics to this term prebiotic and probiotic. And what is that, and how does that work in conjunction with antibiotics?
So prebiotics are foods that try to help bolster the immune system, and there's a whole list of them on the internet. I haven't had a lot of experience with that. I think the concept of eating clean, so to speak, being healthy, having good food choices, I think that's a great idea. I think every physician would probably support a good, healthy diet, and there's certainly some foods that have certain health benefits. The idea of a probiotic is usually it comes in a powder or a pill. You've heard of them, Culturelle, Align. They're advertised all over the television and in the pharmacies. And the concept of that is when you are taking an antibiotic, or if your GI tract is somewhat irritated sometimes, that if you take a bacterial supplement that will replace any of the bacteria that you have in your colon that are being killed when you take an antibiotic. So we have this concept of, okay, I'm sick, I've got strep throat, I'm going to take this antibiotic to kill the strep throat. Well, the antibiotic does kill the strep in your pharynx, in your throat, it does. But that antibiotic will also affect the other bacteria in your colon. We all have bacteria in our colon, not our stomachs necessarily, but our colon. And so that helps with our digestion. And so when you wipe that out, then you can leave yourself open to more other harmful bacteria that can get to your colon. Specifically, something called Clostridium difficile, which is a kind of a bacterial overgrowth of your colon. And so the idea of a probiotic is to avoid potential problems with side effects from the antibiotics that you're taking. Because
essentially antibiotics, the goal is to kill the bad bacteria that's making you sick, but ultimately it's killing all the bacteria.
Correct. There'd be a super nice way if we could figure out, okay, we're going to make this drug is going to kill that bacteria and no other bacteria.
But that's not realistic at this point.
Well, right. I think some people somewhere are working on this to try to figure this out.
I'm sure there are really smart people doing that right now.
Right. I'm sure there are too. So I think the idea of kind of targeted therapy is really fascinating.
Mm-hmm. So the probiotics would be something you would recommend to anyone taking antibiotics to help balance the good and bad bacteria?
Yes, especially if you're on antibiotics for a long period of time. Sometimes some people will say, I have kind of an inflammatory bowel issue problems and I take a probiotic and it really helps my stomach. Well, that's great. Certainly you're not on an antibiotic at that point, and there are some good benefits from that. A lot of the primary care doctors and the GI doctors can really speak to that part of it. But if you're on an antibiotic, I think most physicians will agree that we'd want you on something to try to help minimize the GI side effects. One of the things I always tell my patients is the stronger the antibiotic, sometimes the worse the side effects can be. Nausea, bloating, other things.
So is there a point? What I think I've learned today is that I need to be honest with my doctor, and all of our listeners need to be honest with their doctor when it comes to giving good history and background and be good patients and take our medicine and not drink.
Right. Well, the hard part about all this is it does take time to do all this, to get through all that in an office, because right now we're having a conversation. Patient visit is kind of like a conversation, and not all conversations can happen in 2 minutes.
Right.
So it's hard to know. And the other thing too, which we didn't mention before, which I do think is a good thing to mention, you talked about, having that conversation with the doctor, is what other medicines are you on? Because there's some medicines that react with certain antibiotics. And so sometimes if you're on a lot of medicine, sometimes we have to stop some of the medicine that you're taking so you can take the antibiotics. Sometimes we have to avoid certain antibiotics because you're on certain medications that can't be changed. So coming in with knowing what you're on and knowing what antibiotics that you've been on previously, a lot of conversations we have is like, I was on this antibiotic a week ago. It was that little white pill. Well, the hard part is there are a lot of little white pills out there. So it's hard to know. So yeah, those kinds of things, those kinds of details, they're really important.
So for those who are suffering with a cold and they start to feel the pain, as you said, in the teeth, and they're starting to feel swollen, that's when they need to give your office a call.
Probably so. It's one of those things where, if you're having those kinds of symptoms after you've had the start of a cold, assuming that you're going to be getting a sinus infection with those symptoms.
Well, thanks for explaining antibiotics today. I feel like I know so much more now.
Well, Stacy, I'm glad we could help. We're always here to try to help educate and make sure people have good, healthy habits.
So if someone feels that they need to come meet with you and get you to look at their sinuses, how can folks get an appointment with you?
Call. I think that's the easiest thing. The direct line is 470-8823. I've always got to repeat this because I say it so fast. So it's 251-470-8823. And of course, we have appointments on the website. It's drronswain.com.
Great. Well, thank you so much. This has been a very enlightening conversation. I look forward to the next one.
Thank you, Stacy.
Thanks for listening to the Swain Sinus Show. Please subscribe to our show on iTunes, Overcast, and anywhere you download your favorite podcasts. Want to know more about Dr. Swain or to schedule a consultation or appointment? Visit SwainSinusShow.com or call his amazing nursing staff at 251-470-8823. We would love to hear what you think about the show. Email us at drswain@drronswain.com. Again, thanks for listening. Breathe easy and have a great day. This show is brought to you in part by the fine physicians and friendly staff at Premier Medical Group in Mobile, Alabama.